You want to be an ICU nurse and you want to work in a high acuity ICU, but nobody's been able to explain to you exactly how to figure out if an ICU is high acuity or not. I can, because I'm your big sister. My name's Anna, I'm going to be a CRNA in about 3 weeks, and I worked in a bunch of different ICUs as a travel nurse, so let's get into it. First thing that I'm going to recommend that you do is you Google how many number of beds are in the ICUs that you're applying to. Shock trauma, for example, one of the most famous trauma centers, if not the most famous trauma center in the US in Baltimore, Maryland, this is like how many inpatient beds are in the shock trauma tower. I would caution against considering things like US News and World Report, like weighing that too heavily. That's kind of just an arbitrary ranking, and it doesn't really tell you the acuity of the patients that you're going to be dealing with day to day. However, if you're going to work on a transplant unit, like a surgical transplant unit, the SRTR website can tell you the outcomes of organ transplantations in your target states. So this is it's a really interesting website. It tracks the data and outcomes of everybody who gets an organ transplant and their likelihood to have complications, and also the number of organ transplants performed at each center. But as a future ICU nurse, this also tells you where does the highest volume of transplants in your area, and it gives you an idea of where to apply to. So for example, if I wanted to be a cardiac ICU nurse, I would apply to the highest volume cardiac transplant programs in the country. And that's SRTR. Let's dispel the level 1 trauma thing once and for all. It does not matter if you're working at a level 1 trauma or not, unless you're working in a trauma ICU. If you're doing cardiac, if you're doing neuro, it does not matter if you're working in a level 1 trauma center or not. What matters is the acuity of the average patient that you are going to be taking care of on a day-to-day basis. So this means if you walk through the unit, how many patients are requiring intubation, ventilation, if they have an arterial line, if they have CVP monitoring, if they have a Swan-Gaines catheter, if they're requiring invasive support, so like CVVH, balloon pumps, Impella, ECMO, LVADs, things like that. How often are you receiving fresh surgical patients back? This also goes into a good point of looking up the surgical volume if you're on a surgical ICU. So here's an order of operations that I would recommend. Number 1, look up SRTR and then look up the volume of surgical volume and transplants of all of the top centers in the US. And then from there, look up the number of beds on each unit that you're applying to. And then when you go and you interview in person, walk through the unit and look at how many patients on the unit require those type of invasive devices. You want for at least 50% of your shifts to be managing a patient who is requiring active titration of vasoactive medications or is on a support device of some type, either a ventilator, CVVH, ECMO, something like that, to work in a high acuity ICU. And once again, doesn't matter if it's a level 1 trauma or not. Hope this helps.